Is the 4-6 region. We had done an extraction roughly 12 weeks before. We have excellent healing. That's the ridge width there. And we have approximately 10 millimeters of alveolus width. Vertical dimension is unchanged. A very favorable site. And this area is scheduled to be restored with the help of an implant retained crown. The procedure will be flapless. We will not raise the flap. We'll go right through the gums. A very simple, straightforward procedure. Just a pinch. नीचे वाले होठ पे लगाओ, ऊपर नहीं, और कोने पे लगाओ, दोनों तरफ लगाओ. और in the motor speed I have kept it at 1200 rotations per minute. Ma'am, please open him out. Zuban, open really wide. Now the axis is occlusal, and we want to center the implant to its ideal placement position. The cross reference is always through the mirror. Now as I'm looking occlusally, 12 o'clock position, what I see is I'm in center, but not really. So that's the starting point. We need to verify it from the buckle. Now that is the center. And our inclination needs to follow the inclination of the roots. We also need to correct any discrepancies in angulation with the natural T. And our occlusal axis screw for implant retained crown. There we go. So that's my initial marker. And what it also allows me to do is to gauge the quality of the bone. The next one is my pilot drill, and we need to go right to 13 millimeters plus another 3 for the soft tissue. The rotations remain the same, the RPM remains the same, no change there. There we are. So we made the first pilot drill to depth of 16 millimeters from the gingival surface. Now I would go on to 2.8 and I would be doing it in reverse. So remember the setting I've changed. I've gone from clockwise to anti-clockwise rotation of my drill. There we go. Change the drill again. We'll go on to 3.45. Again the same setting, no change in the setting, it's anti-clockwise. And there's a constant to and fro motion for me. The reason being, I do not want to overheat the bone. The next drill we'll go on to is 3.9. Same setting, no change in the setting. There we are. And that is all I would go on to. But at the same time, I'm going to the depth again with my 2.8. Again, anti-clockwise rotation, no change in the setting. There we go. Please, gentle hands, that's all you need. So my osteotomy is ready. I will now proceed on to the implant placement. I'll need my driver, I'll need my wrench. So that's our implant, G5, length 13, and that's active plus. That's my finger wrench. That's my engaged implant. And you can see the design of the implant. It's got a cutting thread, it's narrow at the top, coronally giving you the platform shift, at the same time preventing any trauma, compression trauma around the collar. We irrigate it with saline. And now we are ready. Open really wide, stretch please. Okay, so first few rotations I'm going to do with my finger itself. We take that out and we go to the torque range. And as you can see, it's merely manual torquing. As I reach the zenith of the torque, I would go reverse it, take it out again, flip it around, and we go back to insertion. There we are. I flip it around to release any tension build up. Flip it around again, and there we go again. Remember, we needed 3 millimeters for the gingival tissue. You can see I'm just at gingival zenith right now. So I'm going to flip it out, and I'm going to turn the implant back out, flip it out again, and insert. Let's take that out. Now, as you can see, I'm around a millimeter from the gingival crest. How much do we need? Anything between 2 to 3 millimeters is what you're looking for. Flip it out again. And while I'm doing this, the bone gets condensed without increasing any excessive torque on the bone. Now we're roughly around 1.5 now. I'll take it more, give it a few more turns. There we go. And remember, we do not want to over torque and not release any tension build up in the bone itself. That is very detrimental. Ma'am, you'll feel some pressure. That is normal. Do not worry about that. There we are. I'm just going to check my positioning. So you look at the positioning from the buckle, and that's your implant collar there. We have run about 1.5 millimeters on the lingual, 1.5 millimeters. There we go, 2 millimeters on the buckle, and more for the interdental papilla. Now we are going to use the gingiva former to essentially contour the soft tissue. What we don't want to do is go too deep and have a crown sitting too low. That's not aesthetic at all. And just to confirm, I'm on sound bone. There we are. That's your crest. And there. I still want to go a little bit deeper. So I'm going to turn the implant out a bit to reduce any buildup of stress on the bone. There we go. Just a couple of turns do. There we go. 1, 2, 3, and 4. Happy with that. That's our 4mm gingival former. And it's finger torque only. There we go. That's your healing abutment in situ, and that's your lingual profile, dead center. That's your occlusal, dead center. I would like you to focus the lens on the image in the mirror. I would like you to rub your lips together for me. I'd like you to open now for me. Open wide. There we go. So we are looking at CEJ in aesthetic lineup with the rest of the teeth. We don't want a too long a crown. Remember that. That is the implant placement, clinically dictated. Let's increase the contrast a bit. Increase the contrast more. Let's go a bit more. You can see the zenith of your bone. That's the zenith, and that's the buccal, that's the lingual there. You can see the two cortical plates simultaneously. So ma'am, the instructions are that don't have anything hot. Hot means really hot. Lukewarm doesn't matter. So what we have done there, we have under prepared your bone, and the implant has compacted the bone rather than drill everything out and lose all that bone. Now because of that, we made a tiny hole. What I put inside is bigger, even around the gums. So there's no bleeding, nothing at all. Discomfort, you might feel a little bit of pressure because I've inserted something there, and that will disappear in a couple of days. So you might need to take some Nurofen tablets, ibuprofen tablets, 200 to 400 milligrams, 3 to 4 times a day.
How many days?
As long as you need it. So there's no.
If I
Don't need it, don't take it. You don't need to. And
how severe will be the pain?
you won't get pain. You'll feel discomfort, pressure.
Okay. No pain.
No pain. Yes, initially yes. I'll have to give you now. So I'll give you 2 tablets now, 200 milligrams each, or 400 single strength, and that's all you need for the moment. Then you repeat it as you need to for a couple of days or so. That's about it. You don't need anything after that.
If I feel the discomfort.
If you feel after that,
Otherwise,
you don't need to.
I can.
No. And then from tomorrow afternoon, I would like you to do warm water with salt rinsing. And just normal brushing, cleaning. You don't have to worry about
What time
anything.
do you want me to start
Oh,
tomorrow?
same time? The time we finished?
Can I have hot milk tomorrow at
Yes,
11:30?
Absolutely. Absolutely.
11:30? Very hot?
You can have anything you want to.
After 20?
Very hot means, you don't want to burn your skin.
No, 24 hours.
24 hours is good enough. But I would still not want you to hit extreme temperatures, either which way.
For how long?
At least a couple of days. There are no stitches, there's no incision, there's nothing. So I don't have to do anything. I'll just see you for a review appointment to see how you're going.